Good morning, everybody. Good afternoon, good evening, wherever you are in the world. Welcome to our event today on food security in Southern Africa and the impacts of COVID and perhaps environmental change. My name is Tim Benton. I am the Research Director in Emerging Risks, and I direct the Chatham House's Energy, Environment and Resources team. The Chatham House Environment and Society discussion series encompasses a broad range of issues that we work on in our department at Chatham House: climate change, food and sustainable land. Sorry, my computer's frozen, as it often does. Food and sustainable land, circular economy, governance, natural resources, energy access, energy transition, and the move towards the need to more fully integrated people's needs into the way our economies work. Our focus is really on the challenges, opportunities, and policy implications to address evolving issues within these broad areas. What are different actors neglecting? What radical changes or policies are needed? And what would help equip policymakers and practitioners to better deal with these challenges? Today's event is particularly dear to my heart as it's associated with a £10 million research programme I run called GCRF AfriCap, the focus of which is on climate smart development of food systems in Southern Africa. And an important component of that is, of course, not just not just finding a way to live in a world where we can produce the right sorts of food for the populations whilst climate change is happening, but also building resilience to the sorts of shocks that climate change and wider environmental issues will throw at us, of which, of course, COVID is perhaps one. So developing climate smart agri-food systems in sub-Saharan Africa is a precondition for achieving sustainable development goals. Over the years, food security has been affected by different shocks, including climate change and COVID. The impact on rural households in Southern Africa, in particular, has been significant due to the structure of food systems in the region. Today's event aims to take a deeper look at the interlinking issues of food security, nutrition, climate change, and food systems in Southern Africa, and consider how practitioners and policymakers can build more equitable, resilient, and better food systems. Just a little bit of housekeeping before we get going. The format of today's event is as follows. We've got three fantastic speakers who will each speak for about 10 minutes, and then we will move into a question and answer session. As we move through the speakers' presentations, if you do have a question, please put it in the Q&A box as we go along. Perhaps mentioning if you want to ask a particular speaker, otherwise we'll address them at the panel. You can, I think, also upvote questions in the sense that if you like a question that someone else has asked, use the button to put a tick next to it, and we will ask questions that have the most ticks as a kind of simple way of doing it. Now, I want to introduce our three panelists. We are very lucky to have three such distinguished guests today. Firstly, we will have Professor Sheryl Hendriks, who is Head of Department and Professor of Food Security at the University of Pretoria. Sheryl Hendriks is a food security policy expert with extensive experience in policy analysis and program design. Her research focuses on food security, nutrition policy analysis and monitoring, and evaluation of food security at household, national, and global system level. I've known Sheryl for some years, and I know that she is a fantastic person with her fingers in many very important pies, and has been on the high-level panel of experts in the FAO for the Committee of Food Security. Our second speaker is Dr. Ousmane Badiane, who's Managing Director of Academia 2063, and he's also recipient of the Africa Food Prize in 2015. Dr. Badiane is Distinguished Fellow of the African Association of Agricultural Economists, recipient of the African Food Prize, and a member of the World Academy of Sciences, and is founder and executive chair of Academia 2063. He has over 30 years of experience as an academic and a practitioner in international development. Previously, he was director for Africa at IFPRI, the International Food Policy Research Institute, where he was instrumental in developing and guiding the implementation of the comprehensive Africa Agricultural Development Programme, which we all familiarly know as CADAP. Our final speaker is Mr. Mengistu Haile, who's Regional Director for Southern Africa in the World Food Programme. And he's just said to us, this is his second week in post. He spent most of his professional career in the development and humanitarian sectors, a strong advocate of public-private partnerships, which he firmly believes are essential to fulfill the SDGs, to change the lives and livelihoods of millions of marginalized people. Before he was appointed as Regional Director of the WFP covering Southern Africa and the Indian states, he served as a representative and country director of WFP in Egypt. So without further ado, Sheryl, do you want to come up and start your presentation? You have about 10 minutes and I will wave at you when the time comes. Sheryl, over to you.
Thank you so much, Tim, and thank you everyone for the opportunity. I see many participants who are very good colleagues in the link. Sorry, can you see my screen? Thank you so much for this opportunity. And it's wonderful to be part of this panel with Ousmane and Mengistu. We go back a long way to designing the CADAP food security plan in 2007. So I'm sure Ousmane will explain how far Africa has come in terms of implementing the CADAP plans. So let me focus on the topic that Tim, you asked me to, and that is on food security and nutrition status in Southern Africa. So just to start, because I think it's important that we understand in terms of COVID, the importance of nutrition, wellness and health. We know that a nutritious diet is nourishing, it's protective of diseases. These include micronutrient deficiencies, degenerative chronic diseases, as well as mental health. It promotes immune functioning, which is crucial, not only for COVID, but for many other diseases, and it's productivity enhancing. So we know that nutrition and undernutrition in particular leads to a vicious cycle of life cycle problems that are implemented right from what we call the first 1,000 days from conception till 2 years. And a poor start to life has many implications from income levels to educational attainment to many different components. Add COVID to the mix, and I think this cycle just becomes even more vicious. And so let me just start off as that as the base. When we're talking about malnutrition, we're also talking about malnutrition in all its forms, which was first defined in 2014 with the Rome Declaration on Nutrition, updating malnutrition to include undernourishment, wasting, stunting, and underweight, as well as micronutrient deficiencies and overweight, which includes obesity, having a body mass index of more than 30. So we're looking at a range of different elements, all of which actually play a crucial role when we're talking about COVID. So a quick background on what the current state is in terms of food security and nutrition in Southern Africa. Just to make sure we're talking about the same thing in terms of food security, we're talking about physical, social, and economic access to sufficient, safe, and nutritious food to meet dietary needs and food preferences for an active and healthy life, extended now through our discussions on food systems to include looking at the entire food system and the impacts of that, so way beyond just production. Of course, the most authoritative report and the most up-to-date on food security and nutrition is the State of Food Insecurity in the World Report, which was released last week for 2021. In terms of food security, the statistics presented in the SOFI do show us a very clear trajectory of where COVID has taken us over the last year. In terms of nutrition, because the turnaround of nutrition data is relatively slow, and many, as I'll explain later, of the nutrition services have been severely impacted and disrupted by COVID, the nutrition statistics are not a fair representation of what has probably happened in the world. The situation for Africa is pretty dire. 1 in 5 people in Africa faces hunger. So 21% of the population. This is double the proportion of any other region. So in the slides from the SOFI, you can see the red line under the world and regions is Africa, and the sort of greenish line that's circled in the second frame deals with Southern Africa. The impact of hunger in Southern Africa has not been as severe as in East Africa, for example. But we do know that 46 million more people were hungry in Africa in 2020 compared to 2019. So we can see the impacts of COVID and other elements such as extreme weather events and conflict. So if we're talking Southern Africa, the particular hotspot is Mozambique. So we know that not only has the country been affected by conflict, but also by a number of extreme weather events, from droughts to cyclones in a very short period of time. Not necessarily all in 2020, but with long-term impacts. In terms of undernourishment, we know that more than 1/3 of the undernourished people live in Africa. This is 282 million people. So again, a fairly large proportion of the population. In terms of food security, measured as the Food Insecurity Experience Scale, we know that in Africa, the number of severely food insecure people has risen by 5.4%. And you can see from the graph as well that we can see an increase over time, but again, in the last year. In terms of the in terms of, let me just go back one, in terms of access to healthy diets, which is very important for food systems because it shows us how you link the availability of food with nutrition, is that 1 billion people are unable to afford a healthy diet in Africa in 2019. And we know that the cost of a healthy diet has increased in Africa. In Southern Africa, this increase has not been as large as in some of the other regions, for example, East Africa, where we see a larger increase in the actual cost of a diet. But the cost per person per day of a healthy diet in Southern Africa is $4.07, way above even the $2.5 per day that sets the poverty line for people. So the cost of a diet is way exceeds the poverty line, and this is one of the major reasons for concern, particularly in the current situation. In terms of nutrition indicators, Southern Africa doesn't fare as badly as many of the other regions in terms of child wasting, for example, is relatively low, and the rates have been reducing. Child underweight is also relatively low, but higher than some of the other parts of Africa. Stunting, though, is high in Southern Africa, but it's important to remember that nutrition, remember from the definition, includes undernutrition as well as overweight and obesity. So if you look at the far end of this slide, you see a considerable proportion of the adult population is overweight or obese in Southern Africa. So we're dealing with a triple burden with undernourishment, micronutrient deficiencies, and also obesity. And obesity has been rising in Africa, particularly in Southern Africa over the last few years. This has significant implications because it's not so easy to target interventions across these three forms of malnutrition. We know what to do, particularly in the undernourishment component. We also have some guidance on what to do with obesity, but what do we do when there's this confluence of these elements? And definitely in South Africa, we see that you have undernourished children living with obese mothers in the same household in very poor rural communities. And so it's a real mix of diet-related problems that has to be addressed. In Southern Africa, it's probably largely related to strong reliance on staple foods. So this is a broad picture of the current context of the situation, but what's behind that, of course, is extreme events, climate events, currency devaluations in some countries like Malawi, as an example, and then also COVID and its lockdowns impacting seriously. We saw at the beginning of the COVID responses in Africa that seems governments completely forgot that people need to eat. There were no real plans as to how the poorest were going to be protected in these situations. And we know that these lockdowns have had a serious effect on mental health, job losses and income reduced, which leads to dietary changes. So people limit their food, especially the diversity of food. It's led to obesogenic environments in many situations, with people being closer to the fridge, staying at home, working from home. The distance to the fridge is much shorter than usual. We're more sedentary, whether you are working from your computer or you're having to operate from home. We know that physical activities, particularly for children, have dropped. No sport at school. They're not playing and running as they would normally. So there is lower physical activity. Access to food has been, and Ousmane knows much more of this and can present it much better, the uneven access to food that we've seen, particularly the work that Academia 2063 has done. So I won't focus on this. The burden on the health systems, of course, has been enormous. Disrupted access to medical services, particularly for children, maternal health, and for chronic diseases such as diabetes, where people are no longer managed. Marie Rule estimates that about 40% of vaccination programs in Africa have been disrupted through COVID. So that has long-term knock-on effects for things like measles and tuberculosis that we need to bear into the equation. Non-communicable diseases have also been neglected through this situation, but we see with COVID that many of these non-communicable diseases are comorbidities related to severe infections with COVID and undesirable outcomes. And we're also concerned about the long-term effects of this, particularly long COVID. We don't really know. It seems as if from some of the research that's been released by one of our health insurers in South Africa, that the chance of developing diabetes within 6 months of a COVID infection is 3 times your normal rate. So we're expecting an explosion of non-communicable diseases. School feeding programs have been put on hold in many countries or are limited. And although there has been a lot of concerted effort into making sure these do happen, just going to school to fetch food exposes many girls, for example, to violence and abuse. Public health campaigns have been halted. The only messages that are being pushed are COVID messaging. And so many of the normal messaging, particularly around children's nutrition, have been neglected. The excess deaths are something else that we really need to be concerned about. These are deaths that are possibly related to COVID, but are not directly COVID positive deaths. And these are quite excessive in some communities. In the province I live, it's estimated almost double the number of COVID deaths are excess deaths. This, of course, has knock-on effects for income, for loss of a breadwinner, for many different components. And of course, long COVID affects productivity. There's also been an increase in violence and abuse, especially amongst young women and girls. So we know, that the impact of pre-COVID food insecurity and poor nutrition has many reasons why COVID is also severe in many people. We know that undernutrition, yeah, nearly done.
30 seconds, yeah.
Okay, has led to many metabolic reprogramming people. It predisposes them to disease and affects immunity. And so this affects the resilience at every level in our food system. So we need a lot more effort on this. Although on the bright side, I think there are many lessons we can learn, particularly around the health messages that have come from COVID and the way in which people have responded. So people getting cooking for themselves and finding ways in which we can use particularly digital surveillance for disease management and for public health concerns. So I think there are some positives, but the situation is quite problematic in Africa. Thank you so much, Tim.
Thank you, Sheryl. That was absolutely brilliant context setting, and it was really good to get in depth the nutrition outcomes rather than just talking about access to staple crops and so on. So put it fantastically in context. Now, moving towards the staple crops, Ousmane, over to you for your 10 minutes of introductory remarks.
Okay, very good. So thank you very much, first of all, for inviting me to this presentation. And it's a pleasure joining the other colleagues here, Marissa and Sheryl, and thank you, Tim, and also your team for the logistics and following through, making sure we can attend here and give this presentation. Let me talk about COVID a little bit, and then what it means for domestic markets, especially staples food markets. There's something really specific about COVID in terms of how it reverberates through the economies. One way to sum it up is that it combines the elements of all major crises of the last decade. It has all the elements of a health crisis, like the West Africa Ebola outbreak a few years ago. And we know that because health issue, but it goes beyond that. It also has all the elements of the food crisis, the global food price spikes of 2008, because it has completely disrupted food supply chains and other supply chains. It has elements of the global financial market crisis of the mid-2010s because of the fiscal response and the disruptions of the capital markets around the world. And it also has the same elements of recurrence weather shocks, whether it's droughts or floods, because of the way it has disrupted our production system. I don't think we have had any crisis that has just covered so many different elements and disrupted our lives. And that has affected every corner of our economies. So I just in the introductory slide talked about how pervasive the implication, the effects of COVID have been, and nothing has been left untouched. There's one thing I didn't mention actually. In all those crises, there was one part of the global economy that was spared, a few geographies that were in the middle of it. COVID has just affected everybody. So nobody to emerge first and pull the others out. So it's really a major shock. Now, in terms of work programs that we've done, and that's going to lead us to talking about staples market prices. We had four, and when I say we, Academia 2063, four major work streams. The first one was just focusing on staples food prices and staples food markets. We knew that global organizations will be talking about your rice, your wheat, and your maize, and perhaps one capital city and a second city. In little tiny Senegal, we looked at more than 30 countries and dozens of countries in all the different countries in Southern Africa. We looked at Mozambique, Malawi, Zambia, Lesotho. Those are the four countries where we did the work. We also looked at how global trade is being disrupted and what it means for countries in terms of market exposure. We know that global commodity prices have been shocked and disrupted left and right, up and down, and depending on your trade baskets, you're more or less exposed or not. But also depending on how you respond to those changes, your growth or your poverty impacts are determined. We did also look at vulnerability at the community level in a context similar to what you would look at in terms of existing comorbidities at the human level. So we developed new indicators to say how different communities are more exposed, not to the disease, but to much more serious consequences if it gets there. So the indicator of vulnerability includes different components like overall poverty levels, food nutrition, insecurity, prevalence of chronic diseases, access to health services, and so on and so forth. So I will not go into the rest. I'll stop here, and then I go to what then we did with the staples food prices. Of course, it was very hard to follow and determine what was the share of COVID in how domestic prices were changing. But before I get to that, let me tell you what the main outcomes are so that you can keep them in the background as I go. Whether you're talking about Southern Africa, Eastern or West Africa, the response of staples markets, food prices, the response was just swift. It wasn't like it was slowly happening. The minute the pandemic hits and countries started responding, putting restrictions and other things in places, closing down markets and transport and the like, prices just reacted immediately. Some shot through the roof, some slumped quickly. But there was something else that was very interesting in that. It is that the response not the spread, how quickly geographically almost every market was contaminated. There was no market left untouched, and that was really very quick. That was interesting, but also the spike, the intensity of price rise also went up over time, and you could see that. So it was quick, it was spreading quickly, it was rising quickly. That's one key message. And what it tells us, and we get to the conclusion, is that we should be better prepared to choose our interventions because market will react quickly. It's going to be spreading like quickly, and it's going to be rising. Maybe go surgically in terms of intervening and trying to find solutions. Going just with a blunt weapon like we did, closing down and interrupting transport and this kind of thing certainly will have impact on the markets. Another thing that's important here is the role of regional trade. It came out from our work that countries that are much more embedded in regional markets had completely different experiences compared to countries that are much more domestically focused in terms of prices. That is something that came out in countries like Senegal, Burkina Faso, and even Kenya. Prices ended up to be determined by local domestic issues, as you would expect. But in Malawi, in Mozambique, and Lesotho, it was a completely different story. It was what happens across the border determined what happened inside. And so much so that not only were the reactions different, but also the direction of change were different. In most those less regionally traded countries, prices ended up to have two distinct direction of changes. In areas of the country tended to be surplus areas, as you would expect, prices would go down because goods wouldn't move. And in deficit areas, prices will tend to go up. And if I say prices go up, maybe just one comment on how we went to describing whether price is high or not. We ran econometrics to be able to estimate, based on the season, post-COVID, what would have been the normal price in markets, okay? And we established that price line for every geography that we're interested in. Then we work with country colleagues to have the actual price during the post-COVID time from March all the way to June and July, and we compared the two. So in these less traded countries, prices were shooting up the roof, but in Southern Africa, Malawi and Mozambique and Zambia, especially Malawi and Mozambique, price went down because those who were dependent on cross-border trade to get the surpluses out, and the prices hit at the time when they just got the surpluses, the production out, okay? The consequences there are different than the consequences somewhere else. The possibility of arbitrage in a domestically closed economy allows you to do something. In a country like Mozambique or Malawi, everybody suffered in the value chain, from traders to farmers and others. households, of course, will benefit from that if they can get to the food and get to the market. So that is a very important aspect here. The lessons from that are that if you're a regionally connected market like Malawi and Mozambique and others, you and your neighbors ought to coordinate how you respond to crises like that. And perhaps not clamp down on the board and find ways allowing trade to take place in a safer way if it's ever possible, or keep the disruptions as short in terms of timing as possible, which is extremely important. Yet, there's a third case. There are countries that are not in the fortunate situation of being surplus countries or export countries like Lesotho. And in Lesotho, the price spikes, which is generalized, whether rural or whether urban. So there too, regional trade played a role in the sense that supplies were not coming into Lesotho and prices went higher up, similar to the countries where you have less regional trade. But here again, changes are generalized. It's not like surplus areas and deficit areas, just almost everybody suffered also rising prices due to the shock. So the bottom line here, Tim, is that markets do react. They do react quickly. And the change spreads geographically over time. It's not like we can go and do what we want and wait it out, and then people do suffer during that time. In places where just Sheryl showed, prices shoot up, people will have issues accessing food. In places where prices go down, like in Mozambique and Malawi, farmers will suffer because they won't have the money to prepare the next season. We're eager to go back and see what's happening in this season and what works there. So coordinating response and being really refined in how we respond to crises has real life impact on people and on how staples markets do operate. So I'll stop here and look forward to responding.
Thank you very much, Ousmane. That was absolutely brilliant and a very rich contextualization of the role of markets and the role of trade in the COVID response. We're running a few minutes behind time, so I'll just hand straight on to Mengistab to give his presentation, and then we will start the question and answer session. There are no questions yet in the question and answer box, so please start putting your questions in, otherwise you'll just have to listen to me ask lots of questions from my own perspective, and I'm sure there are more interesting perspectives out there. Mengistab, over to you.
Good morning, Tim. Can you hear me?
Yes, I can. Thank you, sir.
Yeah. Well, good morning and good afternoon and good evening, depending where everyone is. It's a great honor for me to actually speak at this prestigious event, and thank you, Chatham House, for inviting me. And also, I'm very happy to join this platform with my friends, Professor Sheryl and Ousmane. The issue of food security and hunger has reached unprecedented levels, and all humanity must come together and act today. Just this Monday, our executive director, David Beasley, talked at the Chatham House platform on the global hunger pandemic and made a passionate plea for the urgent action to save lives and livelihoods. Similarly, Tim, you hosted my colleague and friend, Dr. Arif Hussein, April last year, where he spoke about the implications of COVID-19 pandemic for food security and resilience in Africa. Now, today we are discussing COVID and food security in Southern Africa and on the need to build equitable, resilient, and better food systems. Now, in the next 7 to 8 minutes, in my presentation, I will give an overview of the prevailing food systems in the SADC region, describe why current food systems are not delivering the food security objectives, highlight the aggravating factors that enhance vulnerability of food systems, and conclude with some suggestions of interventions that could lead to more equitable and resilient food systems in the Southern Africa. The traditional food systems in the SADC region are largely characterized by the dominance of smallholder farmers with small and fragmented land holding and overwhelming reliance on rainfed agriculture. For the millions of rural communities, farming is the primary source of food, income, and employment. However, food production under this context is highly vulnerable to climate variability and extreme weather events, resulting in recurrent food failures, loss of income, and unemployment. Smallholder farmers, which account for 95% of the farming systems in the region, have had to contend with poor yields due to inefficient farming methods, weak markets, limited access to finance and affordable inputs, limited access to agricultural extension and basic social services. As a result, the smallholder farmers are facing growing hunger and malnutrition in the face of growing poverty and inequality. In the previous presentation, Professor Hendriks actually provided some of the interesting figures for reference. Furthermore, the agricultural sector is impacted by policies that have failed to provide the necessary investments in agriculture. Over the years, many good agricultural policies and strategies at the national, regional, and international continental levels have been put forward. However, the lack of implementation is a major challenge. For example, the African Union under NEPAD developed the Comprehensive Africa Agricultural Development Program almost 20 years ago. Member countries agreed to allocate 10% of their budgets to agriculture. It will be good to see how many countries have reached that level of investment at this stage. The agriculture sector is often not prioritized when it comes to national budget allocation and investment. This is very concerning, considering that high number of people depend on it for their livelihoods and for the food systems. Current food systems are made even more unstable and vulnerable by various aggravating factors such as climate change, insecurity and conflicts, and pandemics. On climate change, the increasing frequency and severity of extreme climate events will continue to destabilize food systems. Given that Southern Africa is a climate hotspot, droughts and other extreme events such as cyclones will continue to destroy infrastructure and community assets and disrupt agricultural activities and needing massive emergency response. It takes many, many years to recover from such emergencies. On conflicts, they disrupt the functioning of systems in various ways. Farmers cannot access their farms at the right time. They cannot access agricultural inputs, services, markets. Conflicts also result in breaking the social norms that have kept rural communities together for generations. It increases forced migration, as well as encourage the youth to be part in the conflict instead of engaging in productive activities. On pandemic, and especially the COVID, it has shown the structural weaknesses of our food systems, not just in South Africa, but worldwide by exacerbating extreme poverty overnight. COVID pandemic and the resulting health responses that Professor Hendriks mentioned, and the economic shocks has forced governments to divert scarce resources from other important development programs. This is likely to constrain the achievement of the CAADP commitment and other development expenditures necessary to develop food systems which were already struggling before the pandemic. The food system in its current form is not working to help us achieve the zero hunger goal. The breakdown of food systems hits hardest the marginalized and vulnerable communities, smallholder farmers, women, and children. The current food crisis that we have in Madagascar, Mozambique, and DRC are vivid examples of completely failed food systems. We need to address the root cause of food insecurity by putting smallholder farmers and their communities at the center of our work. This means devoting our efforts to support and empower rural communities, smallholder farmers, women, and youth. We need to support governments to create the enabling environment to make food systems work for all. We need to support governments to establish functioning social protection systems create income generation opportunities for women and youth within food systems, invest in the use of technology and digitalization to benefit rural communities, respond proactively to shocks and stresses. We also must ensure that the participation and contribution of women, youth, and the community in the development of the food systems. I will use the remainder of my couple of minutes just to focus on the support that WFP is providing to smallholder farmers to contribute to building stable and resilient food systems. One, we are advocating for the development and implementation of policies and programs that support women and youth to have access to knowledge and skills that engage in farming as a profitable business. Invest in developing and improving smallholder irrigation infrastructure and water harvesting facilities using green technology to support transition from rain-fed agriculture to irrigated farming. Reinforce learning and knowledge exchange through farmer-to-farmer visits and South-South cooperation networks. Use of technology and digitalization to improve the availability and use of market information, climate services, and access to financial advisory services. Provide insurance and other risk management capabilities to farmers to help them to deal with climate shocks. And finally, work with governments, partners, and communities to develop preemptive activities such as anticipatory action that prevent crisis and support resilience to climate shocks, which is a key strategy to supporting food systems and governments in the region. Finally, I call on everyone that we need to support the smallholder farmers communities as much as we can if we are going to have a stable food system in the region. Thank you.
Thank you very, very much, Mengistab. That was a brilliant intervention on the role of smallholder farmers. Now we're going to move to the question and answer session. And because it's a relatively small group, I'm going to offer the people who are putting questions in to actually ask their own question. And Hilda Rapp, I'll turn to you in a minute. Feel free to ask any of the questions that you've got in your you've typed into the sheet. But I just want to start off taking chair's privilege to ask each of our panelists a linked question. Firstly, what is the principal lesson that we've learned from going through COVID? And second, given that lesson, do you think it will change things for the next shock? Will we actually have learned more than an academic lesson? Will it actually change things? So if I go in reverse order and start with Mengistab on that one.
Well, thank you, team. Yes, I think we have learned lessons, but as I started my presentation by saying that the food systems that we have, the traditional food system, is not yet ready to support and to deal with such emergence. So we need to have a fundamental change in terms of how the food system is created. Even if there was no climate change, even if there was no COVID, we are still in crisis. WFP would be still here. So my view is that yes, we are learning lessons, but in terms of addressing it, we still have a long way to go. Thank you.
Thank you. Ousmane, over to you.
Thank you very much. I did touch upon a little bit the lessons that I had, but if there's something that we have not done and that we may need to do to be better prepared, it's really about that. Not to be surprised by shocks like this. They're going to be happening again, and they might be as intense and vicious as COVID is. It is to understand the landscape of vulnerability in our economies, both in terms of economic operations, our interface with the global economy, with the neighboring economies, how our entire economic structure functions, at least so that we can anticipate, be more surgical in terms of how we respond. But also at the end of the day, it's the humans behind and how affected. So understanding community vulnerability. The example that I often use, it doesn't work really for a Sahelian like me, but having been in the north, most municipalities will know where to park the snow truck before the snow hits. So can we get to a place where we know when we're facing droughts, floods, health pandemics like this, where are the communities that we have to pay attention to, but also understand where are the weaknesses, what makes them particularly vulnerable. At the end of the day, if you can protect their livelihoods, then the cost of these shocks are less severe than they would be. So that preparedness is, I think, would be a lesson for us to keep in mind for future shocks and how we respond to them.
Thank you. And of course, future shocks are perhaps going to become more common under climate change. And certainly with some of the modelling that our colleagues in the Met Office have done for climate in Southern Africa, it sticks in my mind that the crop failure rate, even under a low climate change scenario, is likely to double over the next 30 years. So whether or not we get another COVID or more pests and diseases, locusts and so on, or these extreme weather events, we have to get better at dealing with these issues. Sheryl.
Can I comment on that one?
Yeah.
Okay, so, yeah, because just talking about production systems and so on, in most crises like this, there's just almost a black box about what's going to be happening to the production systems. You don't know how many farmers are going to the farms again. You don't know how many are going just half of the time. You don't know how many have been forced to use their seeds or the implements. You don't know how many have run out of money to buy the implements, are selling maybe their asset. This is just a lot you don't know if it happens. Mm-hmm. And you cannot get there fast enough and broad enough to get information. Another lesson, therefore, is for us, perhaps in better preparedness for the future, to see how we can use more modern technologies to do some of these old-fashioned things and do them much more efficiently. And I think the use of big data right now and the use of artificial intelligence is something that is available to African countries. It's not like flying rockets to the moon or building a Rolls-Royce factory. It's much more accessible to us. We can invest in that. And using remote sensing, computer, machine learning, we can anticipate. We currently are building a platform, I will send the link, where within 3 weeks of having started the cropping season, we can go and start giving already forecasts of what the harvest might be and what the yields might be. You can extend that kind of work to anything so that you can follow what's happening on the ground, even if you cannot move. Thank you.
Thank you, Ousmane. Sheryl, your number one lesson, and has it really been learned?
I think it's well depicted in a report by the Malabo Montpellier panel released last week, which is called Joining the Dots. And I think that really is what this current situation shows us. Countries have seen the necessity of linking more to these situations than just responses to an emergency. So linking your environmental, climate change, nutrition, health, and finding a mechanism in which to deal with it in a far more joined up way, I think is the biggest lesson that has been learned. As I mentioned, I think there's some wins in the situation, particularly the current Food Systems Summit preparation brings a lot more focus on nutrition, and particularly with COVID, on the non-communicable diseases, we call them, the chronic degenerative diseases, which all find their major root in food, in the food we eat, or the food we don't eat in the case of people who go hungry. And so, yeah, I think there's a lot more focus on a far more comprehensive approach than what we've seen before. How governments will respond to that and set up systems within their countries to manage that integration is going to be the big question post the Food Systems Summit. Thanks, Tim.
Thank you. So what you're really saying is that governments need to take a food system view And it's nice to see that the Food System Summit is driving forward food system thinking, but I am still yet to see any government around the world really find a way of integrating across the different policy silos. So there's lots to be done in future, but at least the primary lesson that everything is interconnected is I think now well embedded. Okay, so moving on to audience questions. As I said, let's just hand the microphone to people to ask their own question if they're comfortable with that. Starting off with Hilda, if you can just introduce yourself to start off with and then ask your question. Please, over to you. Take yourself off mute.
Well, thank you to everybody. I'm Hilda Rapp. I run the Centre of International Peacebuilding, and I have been campaigning for many years for a sort of systems-focused approach to development and peace and conflict management. So you are absolutely heroes for me in terms of looking at the interconnections between the different systems, which are of course also reflected in the SDGs. But very specifically, Sheryl, you have obviously come from a public health background, and I wonder whether you could say a little bit more about Michael Marmot's research and the relevance of his work to the issues we're discussing today. And similarly, Mengistab, you've been doing a lot of research on data capture and on the systemic focus on prevention rather than just always waiting to deal with disaster management. Ousmane, you've talked a lot about supply chains, and I think there are a lot of perverse issues that come through development initiatives where people are basically working against the way in which local communities could become more sustainable in their kind of food production. A lot of questions, but it's the big picture, and I'm afraid we can't just quite unjoin the dots here. Thank you.
Thank you, Hilda. So let's just go around the table. Sheryl, do you want to tackle that first, as you were chronologically first in that list?
Yeah, unfortunately, I'm dealing with a power problem here. So, and I'm not a public health expert at all. I'm a food security analyst. And so, yeah, I'm afraid, Hilda, you would have to explain to me a little bit more about the report you're referring to. But I think there is a lot more awareness of the fact that these underlying nutrition issues are a major driver of COVID response. And the response is very different in different people, but we're seeing huge variations. So we don't know the long-term cardio effects, the diabetic effects. We have no idea of what disruptions this virus will have on human systems in the future. All we do know is that the food system plays a very big role in shaping our future responses to this and other pandemics. Thanks, Tim.
Thanks, Sheryl. Ousmane.
Okay, thank you very much. I guess referring to farmers and they're part of the supply chain and how they affect in places like this, I will have a more general answer, which actually should be pretty evident and intuitive, but we're struggling with it. Farmers own their goods. And we should be recognizing that. In cases like this, the first thing we do basically is to rip that ownership off by talking about our maize, our rice, our whatever it is as policymakers, and we make decisions based on that sense of a collective ownership of maize or millet. And often those decisions, when they come, they hurt farmers. They ought to be given the right to enjoy the fruit of their sweat and owners of their own goods. They produce the maize, it's their maize. So when you're making a decision as a policymaker or a development agency, think about the fact that the maize doesn't belong collectively to the nation, it belongs to the farmer. And therefore, they ought to be remunerated for whatever you do, or they shouldn't be hurt by whatever you do. Trying to manipulate prices, for example, to satisfy the nation's need for food security at the expense of farmers is what we often see. Preventing trade that hurts farmers, that's what we often see. So I think looking back at what farmers represent and their ownership rights to what they produce will help us probably make better decisions in the future and therefore not hurt that part of the supply chain. Thank you.
Thank you, Ousmane. Mengis Stab.
Yes, well, thank you, Hilda, for the question. And indeed, I was involved a lot on data and early warning system development and so forth. What I find really difficult in the African continent is the structure of the agricultural sector. It is heavily based on smallholder farmers. And this is, unless farmers can put their land together and coordinate and consolidate their lands, it is very difficult to see how they can be sustainable. Just to share with the participants, I worked in Egypt for 7 years, and we worked in 60 villages where we looked at the irrigation system, and we found that farmers were owning less than an acre, which is, they call it a fedan, an acre, which is very small. And what we managed to do was to put the farmers, 15 to 20 farmers, put their land together and consolidate that, and then mechanize. And in those 60 villages, we have managed to transform the entire village and to a better agricultural production. And in fact, now the Egyptian government is expanding this to over 500 villages. So it is the land holding pattern is a real problem that needs to be addressed. And this cannot be addressed by individual farmers. It really requires governments to work together with the development community. Over.
Thank you very much indeed. Right, let's move on to the next question at the top of my list. And this is from Mira Shah. Mira, do you want to ask your question live? And introduce yourself first, please. Thank you.
Hi, can you hear me?
Yes.
Great. Hi, I'm Mira Shah. I'm a research associate based at Imperial College, but actually I work with the Malabo Montpellier panel. So Ousmane is the co-chair for the Malabo Montpellier panel, and Sheryl is a panel member, so it's great to be with you both. I have a very simple question, actually, Ousmane. In the work that you've done, were you looking at the role of national buffer stock agencies during this time, and have you found any recommendations for them? Have they played a role at all?
Ousmane, do you want to take that?
Yes, thank you. We have not looked at how they operated the stocking and scheduling of operations, but we do know that most countries resorted to distributing food to the most vulnerable people during the intense months of the crisis. So I would have expected those countries to have started with their own reserve, but we have not looked at it in any particular way.
Thank you, Ousmane. Switching now to the next question from Richard King. Richard, do you want to ask your question?
Thank you, Tim. Thank you, everyone. Richard King from Chatham House. It's a question to Ousmane. I'm just wondering if you can expand a bit on some of the drivers behind the price rises you mentioned in regional markets where the regional response has not been particularly well coordinated. And I'm wondering how much of that is due to fundamental factors related to COVID. So have there been production constraints because you can't get farmers on the fields because they're having to lock down, or because you can't get the produce to market because supply chains have got fundamental issues? Or is that production still healthy, and is the other price rises more a response from some trade measures, either countries not wanting to let the produce out of the country because of fears of shortage of supply, or concerns around imports from other countries and the possible risk of transmission associated with that? So yeah, if you could just expand a bit on the drivers behind the price rises. And then I as a sort of supplementary, with global food prices now at their highest level that they've been in over a decade, perhaps other panelists might also have a view on how concerned we might be about that within the region and what the region's exposure is to historically high global food prices. Thank you.
All right, thank you very much for the question. Tim, if I may answer. Sheryl, go ahead. Yeah, okay, thank you. Yeah, the main driver behind the price changes, spikes or slumps, were basically the shutting down of the staples trades systems, not just the transport sector, because transport between districts was shut down, but also most of the traditional weekly and small rural markets, assembly markets, where traders will go and assemble the supplies and put them in trucks and go to other places. Those markets were also shut down, right? So farmers, when locked down, were not going to any place where they could sell whatever they had. So it was those interventions first that really drove the changes in prices, because they just basically interrupted the operations of markets. Surpluses were not moving to deficit areas. Assembly markets were not supplying to more collecting markets. So things were not just going. And because people are traveling across borders, the same thing happened, right? It was not government trying to control prices or to work with prices, whatever at all. It was a reaction to restrictions and other measures taken to control the spread of the pandemic, and not intentionally to intervene with the staples markets.
And then the supplementary question, given the high prices now and the risk of inflation and a whole lot of economic issues, the third wave / fourth wave with Delta variant, potential of new variants, how is the COVID crisis likely to impact on markets as we go ahead, and food prices and nutrition? So Ousmane first, and then I'll come to the others.
It's going to be very, serious. We had thought we had a big wave, and we tried to keep everything in that wave, and then we solve things and move on. We're talking about avoiding a spread or spillover of the crisis to the next growing season. It looks like every season comes with its own crisis. It's going to be certainly serious, because production is going to be disrupted, that we know. The last crisis, some countries were already beyond their production season. There wasn't really supplies were there in the markets. But now with the full cycle, it's not going to be a country where production would not be affected. It may be different though, because people are reacting to the pandemic differently. I haven't heard of any major serious lockdown yet during this wave, as we had during the first wave, that probably will allow people to continue to do their business as usual. As far as global prices are concerned, though, especially those countries like Egypt and Nigeria and Senegal that depend heavily on wheat and rice, those are going to be certainly facing very, very huge price pressures, inflationary pressures. But a lot of African countries are more reliant on these local food markets, and depending on how local staples production goes and what the conditions for that are, you may have less pressure on at least the food segment of the price index. This is something that we need really to watch and see how things work.
Thank you. And Sheryl, over to you for that question. Given the powerful point you made about how nutritionally adequate, minimally adequate diet is more expensive than most people can afford, given the rolling on of COVID, what do you think might happen from a nutrition perspective?
Yeah, thank you. We did see in the 2007-2008 crisis, and some of the work that Ousmane's team did as well, that there's not direct transmission of global prices to local price or domestic prices. But in this case, we don't know, because the domestic situations are also very vulnerable and disrupted. I'm concerned about three components. The one is dropouts at school, which have long-term effect on incomes, productivity, and GDP of the country, actually. And I mean, we can see in our country what's happening when you have people sitting around. Crime and violence are some of the things that engage young people, and it's already been a threat in West Africa for a while now as well. And so these are real issues that could surface. I also am concerned about long-term social protection programs, because I've seen in some cases governments have rallied around supporting people who just don't have access to food, but they didn't have a long-term vision on this. There wasn't the view that this was going to be a perpetual budget item, and where is the resource going to come from? Mangostab raised the issue of diverting resources into the health situation, which is necessary, obviously, but I wonder if we're going to see a reversal of the gains of CALAP in terms of agricultural investment in the long run. And then the impact on child nutrition. Any blip in a child's nutrition has long-term consequences. And so even just a month of not having adequate food has a serious long-term effect. As I said, it reprograms metabolic functions for long-term. So we see even with children who are stunted or who are exposed to famine in their early life, later they're more predisposed to obesity. So it's not just perpetuation of undernutrition. And I think that the effects on children are going to be fairly long-term. And many of those are not reversible. So it's a long-term challenge. Sorry to paint a gloomy picture. I think we've got a lot of thinking to do about how, with these future waves, how we deal with them in a more long-term crisis mode.
Yeah.
Thanks.
Yeah, fully agree. It's a somewhat gloomy and difficult outlook. Mangostab, from your perspective, how is the situation going to unroll from here? And is the funding for programs like WFP, is it secure? I'm just thinking particularly of the UK's cut in overseas development, because apparently we haven't got enough money to pay for our 0.7% of GDP requirement to invest in overseas development. Is there going to be a double whammy that this crisis goes on, and also there is less international aid given to humanitarian issues such as WFP?
Well, thank you, team, for that question. And as you hosted the executive director of the World Food Programme on your platform on Monday, and you heard him really trying with every possible means, including those rich people who are going to space, and if they could spend some of that money on the poor. Now, the worrisome is that there is increasing conflicts, and we have to deal with emergence in those conflict areas. So you have a lot of resources required in the conflicts, and there is only limited resources. So those countries that don't have conflicts but are suffering from issues of drought and so forth will be suffering. I just came about 2 weeks ago. I was in Madagascar, southern Madagascar, with the executive director. And what we saw there, it is a peaceful country, but the challenge that is affecting the children, women, and the youth is just unacceptable to see in our world today. Now, these are not going to be less. We went also to Mozambique, northern Mozambique, where you have insecurity, you have displacement. So now, with all the COVID impact, the global resource availability diminishing and the conflicts increasing, we worry. And this is why we are all making calls to humanity, and that we need to address, because the world has enough resources in somehow, but we cannot just look at what is happening in the world. Over to you.
Thank you. Thank you. Yeah, no, I mean, it's struck in my mind from talking to David Beasley the other day that he said that, I think it was the 3 richest people in the year, if they gave up 1 day's of their income growth over the last year, it would be a very, very significant contribution to dealing with some of these global issues. So that whole income inequality issue is writ large. And yeah, I agree with you, Mangostab, that there is a lot that shouldn't be acceptable in this day and age. The challenge is how to make that income inequality less, so it's no longer happening. Right, we have two further questions that have come in. One from Rajendra Patel, who can't ask a question live because she's on a mobile. And this pertains to, again, taking a food system view. Within the food system view, if you reduce waste, you're increasing the availability of food, at least in a theoretical sense. So how is food waste and post-harvest losses, how should they be addressed with any new knowledge that we have from COVID? And certainly in some of my conversations, there is a view that food waste is often an economically rational thing to do if food is cheap and you value your time highly. And there is an element of the price of food, whether or not people are motivated to use it and store it or waste it. But obviously in many communities, there isn't enough food to go round, and any post-harvest losses are really instrumental in reducing availability of food. So anybody want to tackle that? I can see Ousmane nodding his head, so I'll go to you first.
Just thinking that if you look at the scenarios in your Mozambique and Malawi and others, when you have slump in prices because things are not moving, markets are not opened, borders are closed. If you have non-perishables like maize to trade, you're okay. But the minute you have more perishable goods involved, and you have the same scenario, it could be actually locally. Let's look at the West Africa side or in Kenya, and you have more perishable goods and markets are closed and in your hands. The waste is probably going to be much more serious than just what we would have had at farm level. So waste at market is also a huge issue. And a pandemic like this, a crisis like this, will tend to exacerbate that word is not coming, but you know what I mean. So that will make things worse in terms of food waste for at least perishables. Thank you.
Sheryl, do you want to come in?
Yes, sure. As we transform food systems and we aim for better nutrition, we know that some of the most nourishing foods and nutrient-dense foods are highly perishable. So I think most of the conversation so far has gone around crops and staples, but managing the loss in terms of more perishable foods is, of course, of bigger concern. And in Africa, we have neglected to look beyond production when we talk about food security. Extending value chains, looking at processing, how we preserve the seasonality of foods, we make foods more available, we smooth production and consumption elements. There's definitely a lot more to look at. But one of the critical elements that's come out of the food system discussions is that Africa doesn't have the energy infrastructure to be able to deal with that loss. And that's one of the big components we have to look at. To mechanize, you need to digitize. For both of those, you need energy and power and a sustainable energy source as well. Thanks.
Indeed, yeah, particularly thinking about cold chains and issues like that. As a follow-on question from Hilda in the chat, in the question and answer makes clear. Mengistab,
so there's some piggybacking we can do on COVID
absolutely.
in that regard, because the vaccines need need supply chains that are cold. So yeah, we can learn a lot.
Silver lining. Mengistab, do you have anything to say about food loss and waste?
Yes, I think the issue of food losses, and especially the perishable ones, I think technology is there, and in various places we are trying this, because nowadays solar panels and solar energy is becoming affordable, and in fact some of this cooling small scale can be done, and of course this is also relates to the harvest losses. So using new technologies, digital technologies, we are in a place where we could really make a difference, and we are starting in some cases. So it's a question of upscaling and sharing. And I in my presentation, I talked about South-South partnership, farmer to farmer, and these are some of the issues that we can share among the experiences. Over to you.
Thank you very much, sir. We have one final question, I think, and then we'll move to giving everybody a couple of minutes for closing remarks. And this question comes from George Steiger. I'm sorry if I've mangled your name. Do you want to introduce yourself and ask your question?
I just want to thank everyone for really interesting discussion. So I'm from WFP in Kinshasa in DR Congo. The question I just wanted to ask was kind of a bit further down the kind of food system, looking at market prices. I think Sheryl really touched on it with, we've not quite had a long-term vision for social protection. I would just really be interested in the panel's thoughts on kind of the changing face of hunger, where we're increasingly seeing kind of urban and peri-urban communities facing increased levels of food insecurity, and what we should be thinking about in the future to deal with this. Thanks.
Thank you very much. Mengistab, do you want to have a go at that first?
Yes, I think the face of hunger is indeed changing, and the urban and peri-urban issue is critical. And one critical problem that we have is that there is a huge unemployment, youth unemployment in the continent, and the youth are not interested to work in farming or in agriculture because they find agriculture not profitable. So what you have is young people moving to cities, and where they should have been producing agriculture, and so this is a challenge that I don't know, how we are going to deal. But unless agriculture is made profitable and attractive to youth, then we have a serious challenge. Now, with the technology that we have nowadays in terms of market information, and also other technologies of enhancing production in peri-urban areas, there are a number of examples that can be enhanced, and therefore then you have productivity in urban areas, peri-urban areas as well, while ensuring that the market information is and the whole food supply chain is enhanced.
Thank you. But of course, that comes with infrastructural requirements, again, clean water, greenhouses, pesticide use, or whatever it might be. And so that transport links. And so we're kind of caught in that question that it's not just about production, it's about the whole system again. Ousmane, Sheryl, either of you want to chip in on that? The role of urban and peri-urban agriculture, and how do we feed cities into the future?
One thing I see there, if I may, Tim, just thinking about it, peri-urban agriculture is facing important threats in terms of its sustainability. Land prices are rising very, very rapidly around urban cities. And we know Africa has the fastest rates of urbanization in the globe. But just thinking about something that's actually affecting me currently and that I thought about a few years ago, urban agriculture is not only competing for land, it's competing for water. Here around Dakar, for example, a couple of years ago, the government dug a huge number of wells to get more water into Dakar, driving down the water table. And I was talking about one of the leaders here and telling them, you'll have to make the choice. Have water now and no fruits and vegetables in the future for your poorest segment of the populations, or you go wisely with the water and you can still have water tomorrow and also have vegetables and fruits. It looks like it's coming faster than I thought, and the water table is sacking already around Dakar. So fruits and vegetables come from further away, more expensive, and they're no longer accessible to. So urban agriculture is going to need a deliberate policy by government to make sure it can be sustained. Otherwise, it's not going to be around any longer.
Thank you. And that reinforces the point we had earlier about cross-government silos and cross-government food systems decision-making. Sheryl, any comment on that?
To build on that, Tim, one of the elements that strikes me is that food is not a component of town planning.
Yeah.
Town planners are not trained around food security issues. They don't even consider food environments and where food pathways flow from. And this struck me when I went to a meeting of town planners from Africa, that it was certainly not on their radar, and something that really should be. And I think COVID gives us there's been some mapping I've seen, particularly in Washington, DC, of mapping people's movements around food chains during COVID, with some absolutely fascinating insights as to how people modified their behavior over that period. But it also comes back to the issue of energy and the preservation of food, because as food system transformation happens in order to feed urban environments, we could be heading for a problem much like we're seeing in the rest of the world, and that the food system actually makes us sicker than healthier. So we have to look carefully at how we deal with that issue. We clearly need food that cooks faster, food that doesn't require as much energy, and that doesn't require, for the poorest, refrigeration or extensive refrigeration. We can do that in two ways. We can do it carefully to make sure we preserve the nutritional value and make sure it's healthy, or we can do it badly and add all the junk that's added to commercial food in the northern part of the continent. So yeah, the opportunities for entrepreneurial development in Africa around the food processing sector to respond to urbanization is something critical. But another element, yesterday we were talking to a zoologist for looking at long-term projections of zoonoses and things like managing rat populations in urban environments, because rats are major vectors of disease, are some of the other components that we really need to link these intersectoral considerations for. Some of our urban communities here in Pretoria tell us as well, stop telling us to grow food, because have you seen the size of our rats? There's no waste removal services. The rats overrun, they just eat anything that comes out of the soil anyway, but they're also biting humans and transmitting disease. So yeah, we need to really think cleverly about all these, and we need to get all the people around the table who need to bring their knowledge and expertise to think clearly around these complex issues.
And join up the dots to follow on a previous conversation. Right, we got 4 minutes left, so let's just go around the table for any final closing remark, pithy comment, note of optimism or pessimism for the future, however you want to tackle it. Mengistab, do you want to go first?
Well, yes. First, thank you for giving us this opportunity to have this dialogue. And as a concluding remarks, that on one hand, I am very positive, thinking of the technologies that the world has, and getting our youth and getting innovative opportunities. But at the same time, I worry about the entire food security, the way the world is functioning, and especially in those areas where we have insecurity combined with droughts, floods, and those women and the children, so I worry about those, and I call on everyone who is capable to support these people that we need to support. Over to you.
Thank you very much, Ousmane. Final thoughts from you.
Thank you. I will stick to the topic that I was spoke about. And here, when we have this major crisis, it's important to look at those that may be forgotten in terms of markets, but also in terms of communities. So it's not always the big guys, your wheat and rice and white and yellow maize. It's also your cowpeas, your millets, your sorghum, your cassava, your yams. Those are extremely important. But also go way beyond even the secondary town and look at the little tiny markets, because that's where really livelihoods are hurt, and then understand that dynamics. Learning from that to set up the network so we can do that, to have the data so we can do it in the future is going to be extremely important for us. the capacity to anticipate. We need to know where communities are, what the conditions are, understand chronic vulnerability, so that when shocks arrive, what we see are nothing else but the symptoms of long-term chronic vulnerability that we have addressed before. If you know that and understand them better, I think we can be more strategic in the future. And finally, as we react and respond, it's really important to be surgical, to be very, very refined, because of the systemic nature of things. One shock is just reverberates through the whole system, and we need to keep that in mind. Thank you.
Thank you very much. Sheryl, final words.
Thank you, Tim, for the opportunity to think about these issues. It's always challenging to focus on specific elements, but I think if we thought we had a definitive list of wicked problems before COVID, we now have to go back to the drawing board and think more cleverly about what the future wicked problems are going to be, and how development responses are going to look at the complexity and the need for more clever long-term development planning around many of these issues. Thank you for the opportunity, Tim.
Well, thank you very much, everybody. This has been a fantastic discussion. Thanks very much to our speakers for your prescient presentations. We just put a link in the chat to a report we published last year, which was an economic analysis of the lifetime productivity losses from people who suffer poor food insecurity, particularly early in their life. And I think, you know, Sheryl's point earlier really struck me, that a month with the wrong sort of food when you're a young child will affect your earning potential throughout life. So this is not today's crisis. This is a crisis that is going to reverberate with us for decades. But there are elements of hope, and fingers crossed we will have learned some lessons this time. Really big thanks, as I say, to our three fantastic speakers, very eminent, very knowledgeable, brilliant. Thanks to the participants. Sorry we didn't get through all of the questions. I hope you've enjoyed this. And obviously very much thanks to the behind the scenes team for putting this all together. And I just want to say a final comment, thanks to Nzimo Mazibuku, who was the driving force behind putting this together on a placement with Chatham House for a few months from South Africa. So thanks very much, everybody. I hope you have a good day. Hope you have a good weekend. Hope you don't suffer from any further effects from COVID, and take care. And thank you very much, everybody.
Thank you for having us, Tim. Thank you very much.
Au revoir. Bye.
Au revoir. Ciao, ciao.